What you're currently seeing on your screen is a child having this condition called the hydrops fetalis. Now, we usually see this condition as a complication in rhesus factor incompatibility. So today we'll be discussing about this rhesus factor incompatibility and what they could result in and what exactly is this rhesus factor, because most times we do concentrate on genotype, not knowing that knowing your rhesus factor is very important, because if you don't know your rhesus factor, it could cause issues in future for you and your partner as well. So today we'll be discussing on that. But before we proceed, I have a single request to make. Please, if you're not following me, I beg now, because yeah, no. Should I kneel down? Please follow me. I do offer free medical advices. So please, when you follow me and also share my post, it reaches a whole lot of people out there. Please, I beg, follow me. If you're still listening, even up to this point, and you're still not following me, why nah? Please, just go and click on that follow button, then come back so that we can start discussing. So that brings us right to the next thing. What is rhesus factor? So rhesus factors are surface antigens that we do see on our red blood cell. I know you may be wondering what is rhesus factor in particular, because all these things I'm just saying now is complete grammar for some people. So you know, when you test for your blood group, some people will be like, I am O positive, I am O negative. That negative and that positive you usually say is that rhesus factor. So you could either be rhesus factor negative or you could be positive. So that's negative and positive you guys usually tag along to your blood group is that rhesus factor. And it is so important, because when there is an incompatibility between a partner, a huge problems do arise. So we will discuss on that. We will discuss on the pathogenesis of this disease. So this disease can be called erythroblastosis fetalis, or you could call it hemolytic disease of the newborn, or you can also call it rhesus factor disease. So we'll dive into the pathogenesis, how it occurs. Now, we don't usually see this on the first pregnancy. No, we don't. I would explain why. This condition do occur after the first pregnancy in subsequent pregnancies. So now, this condition is usually seen when a mother is rhesus factor negative and the father is rhesus factor positive, and the mother is carrying a child that is rhesus factor positive. Now, this child's blood type does not match to that of the mother. So normally, when a mother is pregnant, small amounts of the child's blood is mixed up with the mother's circulation. Now, what I mean is that, there is a connection between the mother and the child through the placenta. You remember I once mentioned before that the exchange of gases, nutrients, and blood are being exchanged between the mother and the child through the placenta. Now, very minute blood from the baby do get to the mother's circulation. Now, when it gets to the mother's circulation, the mother's immune system will see this child's rhesus factor as a foreign body, because it doesn't recognize it. What it will recognize is if that child is rhesus negative. But at this point, unfortunately, the child is rhesus factor positive, like that of the father. So the mother's immune system will see this child as a complete foreign body. So it will start making antibodies against the baby's blood type. Now, this is quite minute, because the child's blood type is not exposed in large amounts to the mother's circulation. So the antibodies being produced are very minute. They can't even do anything much at this point. So they cannot mount an attack to the baby in the womb. That is why I said that this issue is not usually seen in the first pregnancy. No, it is in the subsequent pregnancy. Now, during birth, the child's blood will now mix up with the mother's own. I would explain. Relax. So, during birth, the child's placenta detaches from the womb. Now, there will be a heavy combination of the mother's blood, that's the mother's circulation, and that of the child. So that will give the exposure needed for the mother's immune system to start producing large antibodies against this child's blood type. But then the child is already out of the womb, so I mean nothing can occur again. But then there is this thing called the memory cells. I think this is the basis of what we usually use in producing vaccines. So our immune system have memory cells. That is why when someone has chickenpox, after the chickenpox, the person gets immune against further chickenpox. So chickenpox cannot just infect that person again. So our immune system normally has memory cells. They remember that foreign body, and then when that foreign body comes again, they will mount a heavy attack on that foreign body. They will remember it, and they will come in full force to attack that thing. So that is exactly what happens. So now when the woman gets pregnant again from that same father, gets pregnant again, and then the fetus is still Rhesus positive. Now, that's very normally, I told you, there is a minute combination of the mother's blood and that of the child when the child is still in the womb. Now, just that very normal, minute combination that will occur, the mother's immune system will now mount a heavy attack on that child's blood type. That is the Rhesus factor. Remember I told you that the Rhesus factor is a surface antigen on your red blood cell. So in conclusion, the mother's immune system is attacking that child's red blood cell. So when this child's red blood cell is being attacked, a whole lot of damages occur. Now, the liver and the spleen is responsible for producing these red blood cells. Now, you know, when a child is born and after a few months, it's the bone marrow that takes up this function. But then while the child is still in the womb, this function is being controlled by the liver and then the spleen. So imagine when the red blood cells are being killed by the mother's immune system. The mother's immune system is not coming down because, come on, it's seeing this child as a complete, it's seeing this child's blood type as a complete foreign body. So it's fighting this child's blood type. So when these red blood cells are being destroyed by the mother's immune system, it creates a whole lot of stress on the liver and then the spleen. They have to match up and they will start producing what we call an immature red blood cell because they need to produce something at the end of the day. They start producing something we call the immature red blood cell, and this is called the erythroblast. Now, remember I told you that the name of this disease is erythroblastosis fetalis. Now, that is where the name came about. Erythroblastosis fetalis. Fetalis is fetus that's occurring in a fetus. So this liver and this spleen is distressed, they are also enlarged. Remember, in a normal organ, any organ at all, when that organ is stressed, hypertrophy of course, because it needs to match up to the workload. So the liver and then the spleen would enlarge. Now, the liver being so stressed in trying to produce the red blood cell, the normal rate of producing other proteins, you know, your liver, aside detoxification and hematopoiesis. Hematopoiesis is just production of the blood cells, that the red blood cell, white blood cell, and the platelets. So aside the detoxification, hematopoiesis, your liver cells also produces protein, and one of these protein is called the albumin. So when these liver cells are being stressed to produce the red blood cells, they cannot produce albumin in the same quantity. Now, albumin is a very, very important protein. Albumin normally prevents fluid from leaking outside your blood vessels to your tissue. So imagine in the absence of this protein, or in a shortage of this protein, fluid will start accumulating. That is why at the earlier start I showed you a picture of a child, and I told you this child is having something we call the hydrops fetalis. Now this condition would occur. The child will start building fluid at its tissue. Another thing this child in the womb will yet again face is anemia. Now the red blood cells are continuously being destroyed by the mother's immune system. The child will come down with anemia. Anemia is when there is a red blood cell count that is low, and then the hemoglobin concentration is also low. So this child will come down with anemia. When the child comes down with anemia, there is a cardiovascular failure, because the child, the heart is needed to pump more blood. When you're anemic, it means there is low oxygen saturation, because your red blood cell is responsible for circulating oxygen to the cells that need them. So when there is a decrease in the red blood cell count, the heart will not know this. What the heart will notice is that there is a decrease in oxygen concentration. So the heart will start pumping more blood, so that this more blood will pick up more red blood cells and then start transporting them, so that these cells will start taking in this oxygen. But then in the process, this heart will be overworked, and then this child will come down with cardiovascular failure, and this could lead to death. Another thing that this child can also face is that the child can have a high bilirubin level. Bilirubin is an end product of the breakdown of hemoglobin. Hemoglobin is in your red blood cells. So the red blood cells are being broken down. The red blood cells are being destroyed by the mother's immune system. So when these red blood cells are being destroyed by the mother's immune system, bilirubin production will be high. Now, when there is a high bilirubin production, it goes to the brain of the fetus. Now, this could cause a severe brain damage. Another problem. So most times these fetuses don't even survive all these that I mentioned, and then the mother will come down with series of miscarriages. Sometimes if these children finally make it to term and they are being born, they don't get to live up to a week or so, because they have really gone through a lot in the womb. A whole lot of things has happened to them. This is quite unfortunate, and you will notice in some people, after giving birth to their first child, subsequent pregnancies will always end up in miscarriage for them, or they may end up giving birth to stillborns and the rest of that. So a whole lot of things do occur. So now that brings us to the next thing: how do we prevent this? Now, the first step to prevent is that you need to get tested and be aware of your blood type. Go to more than three. I always recommend go to more than 3 hospitals to get tested. Don't just depend on one result from one hospital. Go to the next hospital and the next. Make sure you go to more than 3 to confirm your blood type. So if you as the mother is rhesus factor negative, when you register on antenatal, insist that they also test you. But then in some facilities, in some antenatal facilities, they test you immediately you register to know your blood type. So when you tell them, or if they test you, they get aware and prepare you for what will happen on the day of your delivery. That's the day you would be exposed to your child's blood, especially on your first pregnancy. It is very, very important on your first pregnancy. Now, they will give you a drug. This drug is quite expensive currently in our country, but they will still give you that drug. You will pay for it because it's very, very important. It's a very important situation, so you will pay for it. Now, this drug is called ROGAM. Now, this drug is an immunoglobulin G anti-D. I would explain. Just the function of this drug is that When the mother is exposed to this child's blood type, that's the first big exposure during delivery. This blood will help decrease the amount of sensitization that would have occurred in its absence, to lower the mom's immunity. Now, the mom's immune won't even recognize the child's blood type is foreign, so they won't just know. They will be kind of blinded. They will blind it sort of. So it reduces the sensitization that would have occurred. This is what this drug does, and it is very important. If you as a mother, you're rhesus factor negative, and then you're carrying a child that is rhesus factor positive, it is very important that you take this drug. Failure to do so could result to a whole lot of issue for you in future. Now, there is something I would love to make clear. If your partner is rhesus factor positive and you are rhesus factor negative, and unfortunately you were pregnant once and you had an abortion, there is a problem. Your blood have mixed with that child's blood. There is a very big problem. Or maybe on the first pregnancy, the mother had an ectopic pregnancy, so the baby was lost. The baby didn't even reach term. Ectopic pregnancies, they are not viable. There is also a big problem. So in whatever thing you're doing, it is important that you know your blood type. I know a whole lot of you will come to the comment section or come to my private DM to ask me, what if the mother is positive and then the father is negative? The answer is that no much damage is done in a situation like this. What is usually catastrophic, should I say, is when the mother is negative and the father is positive. So that will bring us to the end of our topic today, and I hope you really enjoyed it. If you made it to this end of this video, please follow me again. Let me remind you. So bye.